Hello, everyone. Again, welcome to Dental Board Reviews. And so, if you haven't subscribed already, I posted two videos on antibiotics, and also another video was on um, antimicrobials. So, bacteria, different types of bacteria. Once you view the bacteria, and then we reviewed the antibiotics. So then this lectures we're going to discuss pretty much give you kind of a review of certain prescriptions that we use in dental, okay, and head and neck infections, okay. So this will give you a quick review whenever you have a question of what you can give, okay, for the patient. Okay, so the first antibiotic, okay, is penicillin VK, okay, so which is pen VK, and pen VK is given. So you write, you prescribe 500 milligrams PO by mouth every 6 hours, okay, so every 6 hours, and you can give this for 7 to 10 days, okay. Now, if somebody needs a penicillin, IV penicillin, you can prescribe penicillin G, so pen G, and pen G comes in units, in million units. Okay, so the prescription that you give, that you put in the hospital will be 4 million units. Okay, so 4 mmUs, IV Q 4 hours. You can do Q 6 hours, but technically you want it to be Q 6 hours to make sure that you reach the sufficient bactericidal peak levels in the serum, in blood, okay, quickly. So Q 4 hours. And then our favorite one, that in head and neck, okay, in most of areas of the body. So amoxicillin. And amoxicillin, the way we prescribe it is 500 milligrams by mouth, Q8 hours for 7 to 10 days. So if you're a dental student, okay, and you are learning how to write prescriptions, this is one of the prescriptions you need to know how to write. 500 milligrams PO Q8 hours for 7 to 10 days. So you can write this, you can put 7 days, 1 week, or 10 days. And you give the patient the instructions to take 1 tablet by mouth every 8 hours until all gone. So you have to give that as until all gone. Otherwise, the patients will take it, they feel fine after a few days, and they stop taking it. Okay, so you have to write it to the patient that, hey, take it every 8 hours until it's all gone. Okay, so this prescription, you have to know how to write it, okay, especially if you're a dental student. Most dentists, they know how to write it, okay. And then, now, a patient comes in and they have this infection which, you know, has been blowing, and they took some antibiotics. Most of the time they'll come in and say they took some clindamycin, it didn't work. So in that case, sometimes you may go with a more, what we call, it's a strong antibiotic. It's more efficient because augmentin is amoxicillin with clavulanic acid. So clavulanate, remember clavulanate is a beta-lactamase enzyme inhibitor. So it prevents the bacteria from having that resistance to the bacteria, to the antibiotics. Okay, which is the reason augmentin is very efficient in eradicating most of our dental infections. All right. So the way you prescribe it, you can give it 875 milligrams. Okay. So 875 milligrams. This is the milligrams of amoxicillin, and the 125 milligrams is the milligrams of clavulanic. Okay, so it's 875 slash 125 milligrams PO Q 12 hours. So every 12 hours. And then when it comes to, or you can give 500 milligrams slash 125 milligrams PO Q 8 hours or Q 12 hours. Okay, and you can give this for 7 to 10 days. And you have to tell the patient to finish it. Okay, so take it until all gone. So the amoxicillin plus these are the other antibiotic that you need to know. Okay, especially in patients who they come in and they are diabetic and they are not well controlled diabetics or alcoholics or malnourished patients. Okay, so those patients with immunocompromised, not just giving them the regular amoxicillin. So you don't want them to develop infection. So you want to give them the amoxicillin with clavulanic acid, which is augmented. Okay. So use your clinical judgment when giving these prescriptions. Otherwise, it's relatively safe. As I said, the clavulanic acid doesn't change. It was 125 milligrams. Okay. But you have to be careful in patients who have like a chronic kidney disease, especially you have to be careful, but 125 is not bad for stage 3. Okay. So 1, 2, 3 is chronic kidney disease. But if somebody is in a end-stage renal, you want to make sure that you take precautions in giving augmentin, because the beta-lactamase inhibitors, they tend to be nephrotoxic, as we discussed in the previous video. So if you haven't subscribed, go ahead and subscribe so you can review the other videos that I post. And then Unison. So Unison is highly common. It's very common in the hospitals. It's very effective antibiotics. It's a Unison is ampicillin with sulbactam, and you give it IV. Okay, it's IV, and the way you can prescribe it is 1.5 milligrams or 3 milligrams IV, Q6 hours to 8 hours. Okay, very good antibiotic. And ampicillin, so brand name Unipen. This is also IV, so you can give it 500 milligrams IV Q4 hours. Dicloxacillin. So dicloxacillin, I put here as green because for somebody who has salivary gland infections, most of the culprit is Staphylococcus aureus. So this dicloxacillin is very effective against Staph aureus. Okay. And the way you prescribe it is you give 250 to 500 milligrams PO by mouth every 6 hours. And you can give that for 7 to 10 days. Okay. The other antibiotic that you can give for salidinitis, meaning inflammation or infection of the salivary glands, is Keflex. So that's the first generation cephalosporin. Okay, so Keflex, and it's also 500 milligrams. Okay, and we're going to see that. Zosine. So Zosine is a very good broad spectrum penicillin. So it's in the penicillin family. It's a piperacillin with tazobactam. Remember, tazobactam is a beta-lactamase inhibitor. Okay, so it's very broad spectrum and is very effective antibiotic. Okay. So the way you give it 1.5 to 3 milligrams IV, Q6 to 8 hours. That's how I prescribe it. Now, If somebody has kidney issues, you can contact the pharmacist, and sometimes they can calculate and they can adjust the dosages. Okay, because this is IV, so they can always adjust and give the correct amount. All right, so carbapenems. Remember, carbapenems are highly effective against MRSA, okay, against Klebsiella and Klebsiella pneumonia. So very effective. And the good thing about carbapenems, their patients can be compliant with them because they're only once daily, okay. So the envas or a tapanem is given 1 gram IV daily. Okay, so 1 gram IV daily, and you're done. And when it comes to cephalosporins, first generation cephalosporins, we have Keflex. As I said, this is very good to cover staph infection. So most of the time, when you are in the hospital, somebody has skin infections. Okay, you want to cover with Keflex because it's very good against staph. All right, and also, as I said, it's good with salivary gland infections also. So the way you prescribe it, you give it 500 milligrams PO by mouth, Q 6 hours, and you can give that for 7 to 10 days also. Okay, so now remember, in patients who are allergic to penicillin, now you don't jump to give clindamycin. All right, clindamycin actually presents with a lot of issues, and that's the reason it's been removed even for usage of prophylaxis for bacterial endocarditis. Okay, so now when somebody is allergic to penicillin, you can give Keflex. It's a first generation. As I said a long time ago, we said there's cross allergenicity, about 10%, but somebody who's allergic to penicillin, they have only about 2 to 3% chance of having allergy to cephalosporins. So Keflex can be given. If you can't give Keflex, you can give also macrolides such as azithromycin, Z-Pak. So good review for you, and something for references. Okay. NSAF. Okay, NSAF is also a cephalosporin. You can give IV. So the way NSAF works, you can give it 1 to 2 grams IV Q 8 hours. Clindamycin, I colored it orange here because we're moving away in dentistry and head and neck. We're moving away from clindamycin, routine prescription of clindamycin. One, it causes problems. So it can cause cardiac issues. Okay. On top of that, it can also lead to the outgrowth of C. difficile. So Clostridia difficile. Difficile because it's difficult, right? So whenever it says difficile, think about difficult. So Clostridia difficile is very difficult to treat. Okay? So when people give clindamycin, most of the bacteria are going to die except the Clostridia difficile, which is going to cause pseudomembranous colitis. Okay? And that can lead to abdominal pain, diarrhea, and so clindamycin, and most people who take clindamycin for dental infections, the dental infections end up not being resolved because patients are not compliant with the dosages. Okay, and so because of also the side effects that we talk about clindamycin. So we're shying away, we're moving away from the usage of clindamycin. Now remember, clindamycin has good bone penetration. So if you want something to for bone infection, if you try everything else doesn't work, clindamycin works. Okay, but you have to also look at the risks. I think there's a case where a patient was prescribed clindamycin and developed diarrhea, and the dentist didn't tell the patient to stop the clindamycin. Patient ended up having colitis and ended up having surgery, and they lost the colon. All right. And so the patient went back to the dentist, said, "You caused me to have these issues, and so so you are liable." So you have to make sure that when you give clindamycin, you have to tell the patient, "Hey, if you have to give clindamycin, you have other choice of antibiotics. But clindamycin is a culprit, but I don't like clindamycin at all. Most of the time, you give clindamycin, and the infection doesn't resolve for some reason. I think it goes with compliance. But so let's talk about clindamycin. Clindamycin is a certain dosage. It can be bacteriostatic or it can be bactericidal. So at low dosage, it's bacteriostatic because it attacks to ribosomal subunit 50S, right? So it slows down the translation of proteins, so the bacteria doesn't grow. All right. So I can keep talking on the clindamycin, but the way I prescribe it is 300 milligrams to 450 milligrams PO by mouth. So Q 6 hours. All right. Q 6 hours. Now you can also give it IV, 600 milligrams. This one is going to be a bacteriostatic dose. This one here is going to be a bactericidal dose. So 600 to 900 milligrams IV Q8 hours. All right. Most of the time they use it for osteomyelitis, or if you are doing like a necrotizing fasciitis, and you're using broad spectrum antibiotics like empirical therapy, you add some clindamycin. But you have to look out for in patients who have cardiac issues, also patients who have stomach issues. So look out for diarrhea, and if a patient comes in for follow-up, you ask them, "Hey, are you having diarrhea issues?" Tell them to stop it. Now, the beauty of these days, we have probiotics, so you can prescribe clindamycin. Actually, I recommend if you're going to prescribe antibiotics, ask the patient to take probiotics, okay, with those antibiotics, because we are treating bacteria in the mouth or in the head and neck, but we don't want to kill the bacteria in the stomach. So ask them to take probiotics when they are taking antibiotics. Erythromycin, okay. So the way you prescribe it is 250 milligrams to 500 milligrams PO Q6 hours, and clarithromycin. So these medications are very good for lung infections. Okay, so they are very good against mycobacterium. All right, so which cause like TB, so pneumonia. So this clarithromycin is very good. So, but even though we rarely use it, but it's an option that we can use. 500 milligrams PO Q6 hours. Okay. Z-Pak. Now that clindamycin is getting out of the way, most people who are allergic to penicillin, most dentists are feeling more comfortable to give Z-Pak. Okay, and the way you prescribe Z-Pak is 250 milligrams PO Q12 hours. Okay, for the first day. So they take 250 milligrams by mouth twice daily for the first day, and then after that they take 250 milligrams by mouth every day, so 24 hours for 4 days. Okay, and this is very good in patients who are allergic to penicillin. So you can use Z-Pak. Z-Pak is a macrolide. Okay. Now, you always have to specify the time, the spacing. Don't say Q12 hours. Some people can put BID. It It's not the same as BID. Okay, 250 PO BID is not the same as 250 Q12 hours. All right, because when you say BID, what does BID mean? It means twice per day. Now, what's the time frame? Some patients can say, oh, let me take one in 1 hour. 4 hours later, they take another one. That's twice daily. Okay? So you have to specify. Or they can take one after 12 hours and they take another one 4 hours later. That's twice daily. So it's not spaced out. So you really have to specify. I don't like writing BID or TID or QID. Okay? You have to specify the hours. Okay? The duration between each dose. That way, a patient can be more compliant and you are more specific with the patient. Okay? All right. Now, when it comes to fluoroquinolones, a good one is Levaquin. Levaquin is good for UTI. Okay, it's good for UTI in women, UTI in men. It's good for lung infection, pneumonia. Okay, and it's also good for coverage of most of the head and neck infections. Okay. And the good thing about this one is most patients have found that, they may not be compliant with penicillin, cephalosporin, because you have to take 3 times daily. And that can be difficult for somebody who works. So, but these ones, you can be compliant because it's once a day. Okay? So you can write levofloxacin, which is brand name is Levaquin, 500 milligram PO, Q24 hours. Now, you have to be cautious in patients who are younger than 18, who are still growing, okay, because it can cause inflammation of the cartilage, okay, and also in patients who play sports, it can cause, or patients who are above 60, it can cause tendon rupture. So why is a very good antibiotic? Okay, you have to use cautiously. Now, the good thing about this, you can prescribe for 3 days. Okay, it's very effective. You don't have to give the whole 5 days, or you can give 5 days, or you can give 7 days. Okay, but 3 days is the least amount that we've seen very effective, and had no difference between the 3 days and 5 days really. Okay, so it's very effective. Okay, moxifloxacin. Moxifloxacin is also another one which is good for compliance because it's taken once daily. So the way you write it is 400 milligrams PO Q12 hours.